Welcome to the Rich and Mo Physiotherapy series. Today we are hosting Shaynaz in our channel. Shaynaz is treating pelvic floor disorder, and we're going to ask her a few questions about this very interesting subject. You were talking about status post prostatectomy. What other condition, not just men, generally men and women will come to you after what? After delivery, I guess? After
Yeah.
which kind of thing and which complaint usually?
Okay, let me get a little bit more into detail about that. So let me grab this pelvis again, and we're just going to look at the organs that we find in this area, okay? In the front, right behind the pubic bone, we find the bladder. Right behind the bladder, for women, we have our uterus and the whole vaginal canal and the whole genital system on the outside. Behind that, we have the whole anorectal system. Okay, so people that have issues, men or women that have issues with the bladder, are going to either present with incontinence or urinary frequency or difficulty with urination. Okay, so all of that can be treated very easily unless it's a medical issue, and that's where I work closely with urologists. Okay, then let's go just behind the bladder and talk a little bit about the uterus. So when the uterus, first of all, hysterectomies. I see a lot of women post-hysterectomy because there's a lot of scar tissue in the area. So I work specifically with manual techniques and with lasers, and we get amazing results. Releasing all the pain of the scar tissue, because that pain can actually even go into the sacral area. So a lot of times even doctors don't know what's going on in that area, and in the evaluation we can find what's going on. And then let's talk a little bit about the genital system as well. So women who have pain with penetration and postpartum with stitches because there was a lot of tearing, or because of the episiotomy, or a lot of women that I treat have had forceps and there's a lot of tearing inside. That can be treated as well with laser again and with the manual techniques. Okay? Let's go a little more posterior and talk about the anorectal system. A lot of people suffer with constipation. Constipation backs everything up. You start having issues in the colon, the digestive tract. So there's so much that we can work on in that whole digestive tract as well. Okay. So yeah, that's just a capsule.
Now you were talking about urologists. I guess that gynecologists are also referring to you.
Urologists, gynecologists, GPs.
Must the patient, if someone thinks that he has a problem with his pelvic floor, must he go to a doctor and then see you, or can he have a direct access to you?
So patients can have direct access to me because I do a full evaluation, and I always send a report to the doctor. So if they see the doctor after they see me, the doctor has a very extensive list of problems and symptoms.
Okay, yeah. That's great. And now to finish, do you have any tip regarding what to do or what not to do for our viewers in order to keep the integrity of the pelvic floor?
Yes, absolutely. I have one important instruction for everybody listening today. If anybody has told you in the past to start doing the Kegel while they're urinating, please stop that right away. Okay, a lot of, in the past, a lot of the medical population thought that was a good thing to do. While you're peeing, just hold your pee. And it's really, really bad for the bladder, because while you're urinating, a couple of things have happened. Your pelvic floor has released in order for your bladder to contract.
Okay.
Okay, so when you're actually in the middle of your miction, and you decide to contract, well, your brain now is confused, because your brain is the mastermind. Your brain knows that the pelvic floor releases, the bladder contracts, and now you want your brain to do the opposite. So you're trying to contract your pelvic floor. Now your brain has to stop your bladder from contracting, but you haven't finished emptying your bladder. Okay, so there's confusion in that whole loop, and it all has to do with your central nervous system. So please stop.
Okay.
I'm sorry
Great.
I got so technical.
No, that's okay.
but
That's
please
I
stop.
think it's very important. Thank you so much for your for the knowledge that you gave us all in here.
It's a pleasure.
Thank you very much.
Pleasure.